In the world of sports and physical activity, injuries are a common occurrence. One particularly debilitating injury is a ligament tear. A ligament tear, also known as a sprain, occurs when the strong bands of tissue that connect bones to each other are overstretched or torn. This can happen suddenly during activities like sports, or gradually over time due to repetitive stress or wear and tear. The symptoms of a ligament tear can vary depending on the severity of the injury, but common signs include pain, swelling, bruising, instability in the affected joint, and difficulty bearing weight or moving the joint. Diagnosing a ligament tear typically involves a physical examination by a healthcare professional, followed by imaging tests such as X-rays, MRI, or ultrasound to assess the extent of the damage and rule out any associated injuries. Treatment for a ligament tear depends on the severity of the injury. In mild cases, rest, ice, compression, and elevation, commonly known as rice therapy along with physical therapy, may be sufficient to promote healing and restore function. In more severe cases, or if conservative measures fail to provide relief, surgical intervention may be necessary to repair or reconstruct the damaged ligament. This may involve using graft tissue from the patient's own body or from a donor. Regardless of the treatment approach, rehabilitation plays a crucial role in recovery from a ligament tear. Physical therapy exercises are designed to strengthen the muscles surrounding the injured joint, improve range of motion, and restore function. While a ligament tear can be a painful setback, with proper treatment and rehabilitation, many individuals are able to return to their previous level of activity and resume their active lifestyles.